Hello, my name is Dylan Witt, and today we're going to be discussing the overmedication of children with ADHD. Now, who are we trying to reach with this method? The main people we're trying to reach are parents of children with ADHD who have just been diagnosed, or parents who are struggling with the belief that their child is overmedicated. The overmedication of children with ADHD has been a growing concern in America. Parents should seek alternative care options to medications such as therapy, behavioral intervention, behavior modification, in order to effectively manage your child's symptoms and avoid the potential risks and long-term consequences of heavy medical usage to treat ADHD. Now, ADHD is currently a public health problem in America. So why should ADHD be treated as a child? Number one is developing a routine. Creating a routine that a child can follow and develop on as they grow older really helps with the symptoms of ADHD. Number two, kind of going into that routine, is helping the child get organized. Organization skills are really important in order to make sure that an ADHD treatment is successful. Second, it creates a positive opportunity. No one wants to be diagnosed with something. So having the ability to start early and making sure that this is a positive opportunity for the child is important, especially for their mental health. And lastly, it'll allow you to help your child with their planning. Being able to make a good plan and to create a plan really helps in terms of making sure that the child can stay on task and do the things that they need to do. Now, like I said, the cost of ADHD has been rising, and it's become a public health problem in America. So the cost of ADHD in North America, regarding physical and mental health, it's costing $7.9 billion annually. Education is costing $13.6 billion annually. And crime and delinquency is already up to $21.1 billion annually. So the total cost of ADHD in America can be estimated anywhere from $39 billion to $52 billion annually. Now, if we compare that to other significant health concerns in North America, we can see that treating depression in adults is about $44 billion, and stroke is costing America $53.6 billion. So ADHD is already up to the same level in terms of the amount that America has to spend to treat it as depression and stroke. Now, there are multiple different treatment options for ADHD. The one that people know most about is the different medications. Hence, there's 300 or more studies on the medical treatment of ADHD. One that is rising in popularity that we're going to be talking a lot about is behavior modification. There are currently more than 185 studies on behavior modification and how it can be used to treat ADHD. And using both treatments, medical and behavior modification, at the same time, there have been 30 studies, and this is as of 2009, so these numbers are likely a lot greater. So why should you consider these treatments, and when should you? So once your child is diagnosed, you need to work with your healthcare provider to discuss your options as to what will work best for your child. Every child is different. They respond to medications and therapies and behavior modification differently. So make sure you explore all of your options. Get educated on ADHD before you set your child on the path for the rest of their life. Don't be afraid to ask questions. So, results found from the treatment options. This particular case that we're going to be looking at is measured in how many classroom disruptions happen with kids with ADHD. And there are a multitude of different ways that this was measured through different treatments, through placebo, the medication dosage, and then the amount of behavior modification included. So if we look at the results of the study, with the placebo drug, so no medication and no behavior modification, there were approximately 60 classroom disruptions from kids with ADHD in one day. Now, as soon as you do behavior modification on still a placebo drug, that number drops to below 20 with low behavior modification and 10 with high behavior modification. Then you can see at the bottom that we slowly increase the amount of medication that we give. With no behavior modification, going into a high dosage of ADHD medication still resulted in about 20 behavior disruptions in a class in one day. Now, that compared to a very low dosage of only 0.15 milligrams per kilogram with some low behavior modification already lowered that number down to 10, and with high behavior modification already lowered that number down to about 7. So knowing the different treatment options and exploring different case studies and looking at graphs like this can really help you understand how much behavior modification actually works. So the overmedication of children with ADHD is a growing concern, and parents need to seek alternative care options to medication, whether it's behavior modification, medications, lower dosages, therapy, interventions. Those will all help you manage your child's symptoms and avoid potential long-term consequences of extreme medication use. So we've only discussed public health, different treatment options, and the results of those treatments. There is a lot more information out there, and I encourage everybody to find that information and become educated on the subject, especially if your child has just been diagnosed with ADHD. So parents, if your child has been diagnosed with ADHD, please consider seeking alternative care options to medication. Consult with a healthcare provider and explore therapy and behavior modification that can effectively manage your child's symptoms without the potential risks and long-term consequences of medication use. Together, we can reduce the overmedication of children with ADHD and ensure that they receive the best possible care for their unique needs. I hope you enjoyed this presentation. I appreciate you watching to the end. Feel free to ask any questions, comments, or concerns. There are plenty of resources out there to help you. Have a great rest of your day, and bye.